Well, thank you very much, and good afternoon. My name is Aaron Cohen, and first I want to thank the World Bank and the FIA Foundation and the Overseas Development Institute for organizing this event and for inviting me to participate. By way of introduction, I am an epidemiologist at the Health Effects Institute, which is a nonprofit research institute funded jointly by the US EPA and the automotive and engine manufacturers. And we fund research, global research, on the health effects of air pollution. Recently, I co-chaired the expert group that estimated the global burden of disease attributed to ambient air pollution for the GBD 2010 project, on which the estimates in the current report are based. As people have said, this is the first ever integrated assessment of the burden of disease from road transport, which includes both road traffic injuries and air pollution from road transport. It was conducted in what I would call a rapidly evolving global context, especially as concerns road transport emissions. So in the next few minutes, what I want to do is to highlight several aspects of this evolving context that bear on the current estimates that you've been hearing about, attributable, the burden of disease attributable to road transport, and on future assessments that will be essential to tracking this burden over time. So first, these are results of the GBD 2010 project in terms of the leading risk factors for deaths in 2010 on a global scale and healthy years of life lost, or DALYs. And as a result of GBD 2010, we now know that ambient air pollution, in terms of fine particulate air pollution, or PM 2.5 for short, contributes much more significantly to the global burden of disease than we previously thought. And it now ranks among the top 10 risk factors worldwide, contributing to 3.2 million deaths and 76 million years of healthy life lost in 2010. And this burden, I think, as Mark mentioned, has increased about 11% over the past 20 years. Now, over 2/3 of that burden is in the borne by the low and middle income countries of Asia, where road transport contributes a large and a growing share of ambient PM 2.5 pollution. But some progress is being made, and I want to talk a little bit about that. There have been marked improvements in engines and fuels, increasingly stringent emission standards that are driven both by health concerns and by the need to address climate change. For example, the latest generation of on-road diesel engines equipped with particle traps and burning low-sulfur fuel have achieved major reductions in PM and other health-damaging pollutants. Also, increasingly tough emission standards for passenger vehicles are being implemented in some global regions. Now, this slide is from the International Council for Clean Transportation, and it shows promising trends in actual and projected greenhouse gas emission standards for new passenger vehicles from 2002 to 2020, with downward trends in the allowable emissions of greenhouse gas emissions in the US, Western Europe, and China. Now, these developments, I think, bode well for reducing levels of ambient air pollution and hopefully the burden of disease attributable to air pollution from road transport, but only if these things can be implemented on a global scale. But at the same time, the proportional contribution of road transport to overall pollution levels is growing, and that growth is particularly pronounced in the cities of middle-income countries of Asia. In the current report, our estimates were based on emissions data at the regional level, which underestimate the contribution of road transport to PM levels. This slide is from a 2010 Health Effects Institute special report on the health effects of air pollution in developing Asia. And what it shows is the proportional contribution of various sources to fine particle levels in South and East Asian cities where vehicular pollution, and that's the blue slice of the pie, contributes 20 to 35%. Now, this is a larger proportion than we estimated at the regional level. Now, in addition, as more people are living next to busy roads, the population exposure to traffic-related air pollution is increasing. The geographer, Michael Jarrett at University of California at Berkeley, in a recent HEI report, estimated that the proportion of the population living near busy roads in several major world cities. This slide shows residential proximity to the burgeoning road network in Beijing, where he estimates that 76% of residents currently live within 500 meters of major highways and 50 meters of busy streets, where levels of traffic-related air pollution, air pollution emissions are the highest. In addition, our knowledge of the range of diseases that are affected by exposure to traffic-related air pollution continues to evolve. Our current estimates of disease burden focus on chronic diseases in adults, heart disease, lung cancer. But new evidence is pointing to childhood conditions as well, preterm birth, low birth weight, and asthma. The Health Effects Institute recently reviewed the large and growing literature on the health effects of traffic-related air pollution and concluded that living close to busy roads appears to be a risk factor for the onset of childhood asthma. And shortly after that report was published, Ross Anderson and his colleagues from the University of London St. George's Hospital estimated that exposure to fine particulate air pollution was associated with a 16% increase in the rate of new asthma cases in children. And this was based largely on studies where exposure was due to proximity to traffic. So, the current report is an important first effort, as people have said, to estimate the burden of disease attributable to road transport. And we show in this report that air pollution from road transport is associated with significant burdens, even as we have not captured the full extent of population exposure or the likely range of adverse health outcomes due to limitations in available data and methods, which are discussed in some detail in the report. But I think it's important that this report not be seen as a one-off, but instead as the first in a series of periodic assessments with the objective, as Chris Murray from IHME says in the preface to the report, of monitoring progress in reducing the burden from vehicle emissions, so monitoring progress continuously. Moving forward, we need both to improve our estimates of population exposures, especially in places where vehicularization is increasing, and update our estimates of the health risks of vehicular pollution across the lifespan. If we do, and the prospects I think are very good that we shall, what effect should that have on future estimates of the burden of disease from road transport? Well, first I should say that even if we substantially improve our estimates of the burden attributable to air pollution from road transport, we would still expect the total global burden from road transport to continue, as in this report, to be dominated by road traffic injuries for some time to come. But we should also expect that the magnitude of the air pollution attributable burden to increase, leading to increases in the total burden attributable to road transport on global, regional, and country levels. And we would further expect that improved estimates of the burden attributable to pollution from road transport will increase its contribution to the overall burden relative to road injuries at city, country, and regional scales. And finally, that the air pollution attributable burden will in the future comprise effects across the entire lifespan. So, thank you very much.
Aaron, thank you for that.